Welcome back. It is just after 9:30. You're watching BT Vancouver. In his daily briefing this morning, Prime Minister Justin Trudeau covered a number of topics, including the critical need of getting medical supplies to the front lines.
We're working with Thornhill Medical, CAE, Ventilators for Canadians, and a group led by Starfish Medical to produce up to 30,000 made-in-Canada ventilators. These purchases will help increase our capacity to make sure these life-saving machines are made right here at home. We're also working with Nobel Prize-winning researcher Dr. Art MacDonald, who is leading a team of scientists to develop ventilators that are easy to make.
And Canada's Chief Public Health Officer, Dr. Theresa Tam, also spoke to Canadians this morning about the potential benefits of wearing a mask in public. But she reminds that if you do so, it does not mean you have to stop washing your hands and physical distance.
Medical masks are in short supply worldwide, and they must be conserved for healthcare workers and others providing direct care to a COVID-19 patient. Wearing a non-medical mask or facial covering can be an additional layer to protect and not infect others, even if you're not currently symptomatic. This can help reduce spread of respiratory droplets to others when you can't maintain a 2-meter physical distance, such as while you're on public transit or getting groceries.
The reality is that we are operating in a highly competitive global environment, and international logistics are challenging. We are working closely with our partners around the world, including embassies, as well as with on-the-ground logistics and coordination firms, to ensure that supplies can move from source to where they are needed in Canada right here, right now.
It is 9:34 here on BT. Well, school is closed, but this high school student is keeping himself very busy. Tom Walsh introduces us to the 17-year-old who is printing face shields for hospitals across North America in his own backyard.
I just needed something quick, something fast, something simple that we can print.
It may not look like much, but this backyard shed in Richmond is on the front line of the fight against the coronavirus. Grade 12 student Sean Ray is producing face shields for hospitals across North America after his uncle, a doctor in California, described the lack of personal protective equipment there.
He was telling us how he would soon be put in the front lines of treating people with COVID-19, and he was telling us how there's a shortage of PPEs. So after that, I started doing research. I was looking how I can help.
That's when Sean came across the Facebook group Open Source COVID-19 Medical Supplies, a crowdsourcing initiative that shares information and designs for 3D printing of much-needed medical equipment to protect frontline healthcare workers like his uncle.
It's one of the nicest communities I've ever met. It's amazing because I've never seen these people, I've never talked to them, I've never heard from them, and suddenly we're all helping each other and everyone's being so nice to each other.
After he sent a few to his uncle, word got out. He's now in high demand and has produced nearly 200 face shields for hospitals across the US, including in Elmhurst, the current global epicenter of the COVID-19 outbreak.
They're just so grateful because they don't have anything, and without this, they'd be a lot worse off and in a lot more risky of a situation than they are now. So it's just an amazing reaction from them and me, seeing that I'm actually able to help them.
It costs around $2 to make one of these, and it takes about an hour to create it. But Sean says he's not in it for the money. He says he's just happy to be helping those on the front line battling the coronavirus. And if you're wondering why he hasn't made any for Canada, he says it's because he hasn't had any orders, but he's ready whenever he gets the call.
It's a small part compared to what the healthcare workers are doing, being in the front lines and being in a super risky position. And it's also nice that knowing that it's just not me that's doing it, I'm helping what a big community of thousands of people has started.
In Richmond, Tom Walsh, City News.
Amazing. Thank you so much, Tom. It is 9:37 now. BC Ferries is starting to screen passengers for symptoms of COVID-19 on routes longer than 30 minutes. Warning travel may be restricted. The move follows an announcement Sunday by Transport Canada of new measures for ferries during the COVID-19 pandemic. BC Ferries says it has already enhanced cleaning, limited passenger capacity, and is allowing passengers to stay in their cars during sailings. Vancouver Community College has opened its kitchens as a meal prep and distribution hub during this pandemic. It's a collaboration between the City of Vancouver, local chefs, food suppliers, and other agencies. Much of the regular food distribution has stopped for people in the downtown east side. VCC will be providing 2,000 nutritious meals 3 times a week.
We are continually making the meals as we have to be a day or so ahead. Not only are we making the meals, we're also putting them in lunch bags with some snacks, fresh fruit, juice, and let's say napkins in order for the people to eat them. So this is a Monday to Friday operation.
And they say strict physical distancing protocols are in place while the food is being prepared. The community college says funding for this program runs out this week, but free meals will continue. Well, can your pet come down with COVID-19 and then potentially give it to you? Ashley Burr looks into what pet owners need to know.
After taking the dog out for a walk and washing our own hands, there's 4 other paws that can also use a wipe. There have been a small number of animals around the world that have tested positive for COVID-19. But can it be transferred back to humans? And how can we protect ourselves and our furry little friends?
I think this is definitely brought to the forefront animals and pets in general, and what does this mean for, our patients and our pets in times of crisis.
A 4-year-old female tiger at New York's Bronx Zoo has tested positive for COVID-19, and she is not the only animal that has been confirmed with the virus.
There was 2 dogs in Hong Kong, there was a cat in Hong Kong, and also a cat in Belgium. And that cat in Belgium was the only one that actually showed symptoms of disease. And so based on what we know, those animals did test positive for COVID-19, so they were infected, but there is a difference between it being infected and being infectious.
Vancouver veterinarian Lauren Edelman has continued her work at the Canada West Veterinary Specialist Hospital while being extra cautious around pets as research continues to expand on animals' risk of getting and spreading the virus. She says animals can catch COVID-19, but there is no evidence that pets can transmit the disease back to humans.
Theoretically, the virus could survive on the fur. We don't have any, concrete information about how long that might be. But as veterinarians especially, that's something that, we're taking patients into the hospital. So that is something that we, get concerned about, even if it is just theoretical.
Of course, dogs need to go outside and get some exercise. But just like humans, they too need to be social distancing from other pets and people, according to Dr. Edelman.
One big thing would be to avoid people petting them. Even though we're not handshaking, I also really don't want people, petting my dogs when I'm out in public.
He doesn't play with any of his other buddies, unfortunately, which is a sad thing.
Their contact with dogs is pretty low, so it's just trying to keep her socialized as well, too, in addition to ourselves.
We always clean her paw after a walk.
Because we live in the apartment, so we use the bathroom downstairs and clean everything before we proceed.
As there is some evidence that humans can transmit the disease to animals, Dr. Edelman has some advice for concerned owners.
If you're sick for any reason, really behave around your pets as you would around any other human. So you want to minimize exposure to your pets. Like in an ideal world, have someone else look after them. If that's not possible, you want to minimize contact with them.
If you are worried about your pet, Dr. Edelman advises to call ahead to your veterinary clinic before going to the office. In New Westminster, Ashley Burr, City News.
And from one cute dog to another, Russ, I know you're a responsible dad, so Caesar should have nothing to worry about, but it is still scary that our animals could potentially, catch this virus.
It is absolutely scary. I mean, my dog is a loved and trusted member of the family. I shouldn't say trusted, actually. No, he would eat the last cookie on the plate, to be honest. And he's having one right now over there in the garden, thanks to Mike. Mike, our cameraman, has been helping keep Caesar in order around here. And you know what? It's a perfect day if you can find enough space for social distancing. Maybe get a dog walk in with your